Hey, it's me, Dr. Daniel, and I want to talk a little bit about brain health and how it can impact your thyroid. So, of course, we talk quite a bit about the complexities behind understanding what could be really going on with your thyroid and how involved you need to get with respect to measuring all the various biomarkers, not just thyroid hormone, not just antibodies, but also nutrients that are related to that. But even before all of that, we should be thinking about the things that impact the thyroid upstream. And of course, the most important organ in our body that controls every single physiological organ or activity in the body is going to be our brain. So the brain is the most important thing that we need to be thinking about with respect to an upstream problem that could be causing a downstream issue, in this case, the thyroid. Now, when we talk about the brain, there are two specific structures within the brain that we could be thinking about. Number one is the hypothalamus. This is an organ structure that releases TRH, which is a thyroid hormone. TRH then tells your pituitary, another structure in the brain, to release TSH. TSH then goes down to the thyroid, causing the thyroid to release T4 and small amounts of T3. Again, remember, T4 is not the active form of the hormone that we want. T3 is the most metabolically active form of the hormone. So you still have to convert T4 to T3. And there are also reasons or interplays between that conversion and what could be happening within the brain. Now, what are some things that can go wrong in terms of lifestyle or activities that could be impacting brain function, then causing a downstream issue? Number one on the list is going to be high levels of T4 and T3. You see, our bodies are highly adaptive, and what that means is that when there is something going on in the system, in your body, let's just say when you have high levels of T4, that is going to send a negative feedback loop up to the brain saying, hey, we're good, we don't need any more. So your hypothalamus and pituitary are going to down-regulate the signals that are supposed to be sent to the thyroid. So what's one way that you could have high levels of circulating T4 or T3? Well, the most common reason right now is going to be thyroid medication. As we've discussed previously, thyroid medications are some of the most prescribed drugs in the country. And if you're replacing thyroid hormone artificially, basically your brain's going to say, hey, we got it. We don't need any more hormone, so it's going to down-regulate it. Now, this is important because so many times doctors, when they find imbalances in the thyroid, what's the first thing they're going to do? Yeah, they're going to prescribe thyroid medication. And so what happens is if that's not truly what you need, the brain's going to always be trying to flip back and forth. And that's a very frustrated thyroid individual or patient because their levels are never going to be level. They're always going to be going up and down, and you're always going to have to be playing around with your dosage. That is a perfect example of just treating the symptom and not actually going to the root cause of the issue. So that's number one, high levels of T4 and T3. The second thing is going to be stress, and that could be both physical and emotional stress. I work with a lot of high-level athletes, professional athletes, and physical exertion is a form of stress that could negatively impact the thyroid. So you've got that situation. You also have TBIs, traumatic brain injuries, concussions. It could come from car accidents. It could come from hitting your head on a soccer ball repeatedly. So there's a number of things it could be doing. Physical harm or caused physical harm to the brain, which then would cause issues with the thyroid. Now, these physical stressors could eventually translate into emotional stressors. So on a long enough timeline, you're talking about depression, you're talking about anxiety, panic. Of course, there's situational stress, right? Emotional stress, adverse childhood events or PTSD. Those are certainly things that need to be addressed. But again, I just want you to understand that it could be something coming from that aspect that's causing a physical problem, and just replacing hormone is not going to correct it. In that case, you probably need some counseling or some therapy, or you really need to work on improving brain function overall. The third reason is going to be hormone imbalances such as leptin or estrogen. I check everyone for leptin, at least all my patients, especially if they have weight loss resistance or weight concerns, or if they have thyroid issues. There's some strong relationships between circulating leptin resistance, as well as estrogen that could be playing a role with the thyroid. And then number 4 on the list is going to be fasting in general, or low calorie or calorie restriction diets. It's very common for women who feel that their metabolism is broken to go on a crash diet, to go low carb, to go low calorie, and then also combine that with high level activity. And that is just a crash course for your thyroid. So you've got to be very careful with that. Again, these are the most common findings that I see if we're talking about brain dysfunctions that could be creating thyroid issues. Of course, there's also environmental issues that you have to be concerned about. But these are the things that we need to be thinking about if we're having some brain-related disorders that could be causing thyroid problems. If you have any questions, certainly send them my way, or feel free to go to drdaniel.com/thyroid. I've got a free ebook there. All you have to do is enter your email. I'll send you that thyroid book, and it has a lot of other information that hopefully can help you to try to figure out what could be going on with your thyroid problem.